Hello, you're listening to the daily news and discoveries on the Cardio Seeds podcast. I'm Dr. Svetlana Shamon, a lifestyle cardiologist and the founder and president of Cardio Seeds. You probably know by now that I'm interested in provider and physician burnout, and Cardio Seeds provides strategies and solutions for burnout-free, value-based healthcare. Provider and physician burnout is at its all-time high, and nearly 80% of all physicians suffer of burnout this year, 2022. One physician per day commits suicide in the United States, and 1 in 5 is projected to leave medicine altogether within the next couple of years, creating huge shortages of medical professionals in the United States. So, the American Medical Association created a recovery plan for American physicians to reduce physician burnout. And one of the parts of the recovery plan was equipping physicians and their administrators with resources. So the part of that was the Saving Time playbook. And the part of the playbook was, literally speaking, step number 1 was stop the unnecessary work. Well, we know that for 1 hour each physician spends face-to-face with patients, they spend 2 hours performing unnecessary work, literally speaking, doing something that they aren't supposed to do. So, American Medical Association created the roadmap how to, literally speaking, get rid of stupid stuff. And I'm not making up those words. Those are put in the document by the AMA, American Medical Association. They put the abbreviation GROSS, which means getting rid of stupid stuff. De-implement and de-implement and de-implement. Stop the unnecessary work. They put in to this document multiple suggestions how this can be done. But what's even more interesting, they are calculating the cost of the savings per physician, per the organization, if those things are implemented. Because the healthcare administrators want to see the numbers, how much the healthcare organization can actually save, how much money they can save per year if they implement physician burnout, implementation of physician burnout programs in their organization. And the calculations are actually pretty cool. They come from the article which was published before the pandemic. The authors are famous Dr. Kate Shanafelt, who is the Chief Wellness Officer of the Stanford Medicine, and Dr. Sinsky. The article was published in the JAMA, or Journal of Medical Association, called The Business Case for Investing in Physician Wellness in 2017. And they calculate if the rate of physician burnout in the organization is 44%, which is much lower than it is now, and the number of physicians in the organization is 500, then the current physician turnover rate is 7%. The cost of turnover in that organization per physician would be $500,000. And the number of physicians in the organization turning over due to burnout per year is 11, then the estimated cost of physician turnover per year due to physician burnout would be $5,347,222. So it's $5,347,000. So if the organization implements only $1 million interventions per year, which is only 20% of that loss, okay, that they are going to have because of the burnout. only $1 million. The projected reduction in burnout would be 20%, and the turnover with burnout interventions will be 4.8% instead of 7%. The estimated savings would be more than $1 million, and return on investment would be almost 7% per year. That famous ROI that every administrator wants to see will be 7% per year. Exactly. They published the number 6.94% per year. So that's pretty staggering. That's interesting and cool. That was 2017. Now the numbers will be much more dramatic if recalculated for today's current situation in the field. So those measures need to be implemented. They will directly relate to saving money for healthcare organizations, and the return will be incredible. The health of our patients will be affected immediately and affected directly. And thank you so much. Bye-bye.